425th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. Hubert de Silva from our family itself. Let us begin the session with 1 minute silent prayer. Thank you all.
Dr. Ganesh, you can start the session.
Yes, sir. Thank you all. As you all know, the International Forum for Promoting Homeopathy is regularly conducting webinars since the last 1,424 days. And today we were planned to have a session from Dr. Patmapriya, but unfortunately, she has some personal problems. So we have to bring our Dr. Hubert to the stage. And Dr. Hubert, as you all know, is always ready to present excellent sessions in our Zoom. So he's always such a nice person who can deliver at any time. That is the peculiarity of Dr. Hubert de Silva. He has completed his BHMS and then MSc Psychology. That itself shows his intense desire to conquer the mental aspect of a patient and to study the case in details. And he is practicing at Karakutam, Trivandrum for the last 35 years and having excellent practice. And he is one of the backbone of our IFPH team who is there to moderate as well as he is the person who is uploading all the videos every day for our Zoom, for the those who miss to watch the session. So that is the kind of personality Dr. Hubert. He is having very good technical knowledge in computer session. That's why he can do such 1 days for even during his hectic practice. So let me congratulate him on behalf of International Forum as well as on my personal behalf for the same. And today, Doctor will be discussing about management of cardiologic disorders with homeopathy. As you know, he has presented the same subject some of the previous editions of our session, but today will be a different session. So we proudly welcome Dr. Hubert de Silva to this session. Welcome, Doctor. You're muted.
Doctor, thank you very much for Dr. Danesh and your kind words. Today, let us go to our heart. That is important organ of our body. Everyone have a heart. That it may be a good heart or a bad heart or an evil heart. There are so many hearts out there, but we have to discuss about the new heart and new good heart. Let us go to our present share screen presentation. Can you see this? Dr. Danesh, you are mute.
Yes, everything fine.
Okay. Heart diseases. This is in English, it is part 1. I took in Malayalam sessions, and now I think that it is better to take in English session also. Blessed are pure in heart, for they will see God. Blessed are the pure in heart, for they will see God. That is it is a word from Scripture that one who is blessed are the pure in heart. We have to keep our heart always pure. Then only we can see God in everywhere. And in every person, we can see God everywhere in the universe. Wherever we look, we can see God. Every human being is a part of God. So we have to love each other. That is what it says. Otherwise, we cannot see. If we have hatred in our mind, or hatred, or evil things, thoughts about others, then our heart will be contaminated. Tomorrow we are going to celebrate the APJ Abdul Kalam's day. So that time also, he wrote a poem about how to keep our heart perfect and how to become a person pure and to create from the power of God. So we can see that there are so many heart. We can see this. These are some photos of hearts: Sacred Heart, Immaculate Heart, Loving Heart. Talking about heart, you have to consider all this. The heart is the first organ to develop in the human embryo. Beginning in the 3rd week of gestation, by the 7th week, a complete heart with 4 chambers has formed. By the 7th week, the heart starts beating and pumping blood around day 21st to 22nd, just 3 weeks after fertilization. Oh, how wonderful. After 21 to 22 days, just 3 weeks after fertilization, pumping of blood from heart is happening. The early development of the heart is important because it spurs the development of all other organs. Till then, it beats to the end of our life. A heartbeat is also one of the first measurable characteristics of gestation. A child, a baby forming inside a mother's womb after 21 days, after the formation of the zygote to 21st day, 22 the second, it may start pumping blood. This is the development of the heart. We all passed these stages in our early life in our mother's womb. We were in such a shape a few years back. If we are 60 years before, we were like this. Now 40 years back, we were like this shape in the mother's womb. So now we becoming bigger, and we jumped from our mother's belly, came out and lived all this time life. We were completed so many years. But we should understand that this was our life, started like this. Let us go through all these stages. Because I heard that if a mother was sad or had confusion or fear or something, it may affect the child in her womb. It may affect. After the gestation, we know that this forming of the heart, if the mother having any trauma, it may affect the heart or the newborn baby in her. So we have a tail. 18 days, primitive blood vessels are forming. Cardiogenic area, head is forming, And after 20 days, it becoming like this. Endocardial tubes are forming, fusion into primitive heart tube, tonsils, arteriosis, bulbous cordus. There are different parts are forming in the organ, heart organ. After 23 days, I told that it start pumping blood. Body, it becoming, and we have a heart, a big heart. Is it good, a big heart or a small heart? A person having a big heart means what? A person having a small heart, what's the meaning of it? Physically, a big heart is a bad heart. But spiritually, a big heart is a good one. We should have a good heart. We may say that we should have a good heart. The physical heart, if it is small, it is good. If our outer heart, our spiritual heart or our mental heart, we may always say that my heart, I'm thinking about, we always feel, every feeling of our body will affect heart. That is important. Even though any cases come to our clinic, that time we should watch their heart. Because each and every motion, every feeling, everything, every feeling and every activities will affect our heart. Even a virus infection, it will affect heart. Even a bacterial infection, it will affect our heart. If there is a feeling, that will affect the heart. If there is hormonal changes, it will affect heart. Anything. If we have fear, we are running after seeing a dog barking back, following us, that time our heart will jump like. That time our hormones will produce. We know that adrenaline will flight and everything. That time our heart will beat more. The fetal heartbeat will be more and it will coming. The rate of rhythm will come. This is our heart having different parts. There may be problems in anywhere in the heart. We know that superior vena cava, this is coming from the above downwards, and this is inferior vena cava. It is coming from the bottom to heart. It will reach in right atrium, the blood from different parts of the body will reach in our heart, in the right atrium, and it will go to the right ventricle. That is through the tricuspid valve. This valve, tricuspid valve, may be affected with many things. The coming of blood from different parts of the body will, sometimes it may reduce. The volume of the body, blood coming from different parts of the body will be reduced. That time, if there is blood pressure and the lumen of the blood vessels are smaller, and if there is any obstacles or any thickening, the blood flow to the heart will be reduced. We know that calcification of the blood vessels, fatty degeneration of the blood vessels, smoking, and impurities of the blood vessels inside the mirror. The thickness of the blood vessels will be reduced and thickness will be more. That time the lumen of the blood vessel will be smaller in size. The blood will come to in the heart will be reduced. That time We may have numbness of our extremities. That may be the peripheral extremities first will be affected. While we are watching a patient, we have to watch a patient's extremities. Why? Because from the extremities, all this blood are coming to the heart. The color of the extremities, lower limb, upper limb, we may check. Why? If the color of the extremities are darkened, there will be, we can suspect that the blood is not properly transferring from that part. Here, after reaching the heart, reaching the right atrium, it may go to right ventricle. We have studied in our college days, rheumatism leaks the joint and bites the heart. And tonsillitis may lead to heart diseases, valvular diseases, and thickening of the blood vessels. We know that with rheumatic arthritis or rheumatic complaints, that is pain and all these difficulties of walking and numbness and painful fingers. That time, we suspect. In tonsillitis, we know that after quinsy and everything, whenever the tonsils are affected, the lymphatic system will be weakened. So we should give much importance to treating tonsillitis because it may lead to valvular disorders. All the valves may be affected. Mitral valve, tricuspid valve, aortic valve, and these are the valves may be affected. And if the blood vessels are thickened or the impurities are adhering the blood vessels surfaces, then it will automatically, it will reach to the heart and it may affect the functioning of the tricuspid valve, mitral valve, all will happen. Because the thickening will also affect the valves. We know that the calf muscle, our calf muscle is, we say that it is a venous heart. One person who is very healthy, that time his calf muscle will be very powerful one. If we are giving any exercise to the calf muscle while cycling or like that, running and every activities of our activities will affect the health of the, it may improve the health of our calf muscles. And the calf muscles is anti-gravitational forcefully, it is pumping the blood from the lower part to the heart. That is why it is very much important in the health of the body. If a person who is cycling, that calf muscle will be stronger. That means that person is strong. The blood will reach heart. So there are conditions I said. The valves will be thickened and the flow, there will be chances of blood go back. In the blood vessels of the calf muscle or that area, the lower limbs, there is also vessels. There is also blood vessels. We know that. Veins are there, big veins are there. That veins also having this type of valves. So their valve are affected in the varicose veins. We can see that there is varicosity of the veins and bulging of the veins and painful, they cannot walk. That time, our medicines we can think about, there are so many medicines we have homeopathically, we can treat. So many medicines help. Calcarea floor, pulsatilla, Oramet, Spigelia, cactus, carbovage, arsenic alb. These are the medicines we are generally using. Belladonna, even belladonna, we can use to reduce the pain. And another medicine, we know that we are using the tissue remedy, magnesium phosphates, MAC-phos. MACPHOS in its lower potencies, it dissolves the attractions of the blood vessels. Calcium, CP, calcium phosphates, it may dissolve the thickening of the blood vessels. These are the medicines we can use in pressure, high pressure, blood pressure. Why these blood pressure are coming? This is due to the blood vessels are not properly functioning. So let us go to the other. We know that this pumping, the blood is coming from this stage and it will reach the lungs and it may come back to our left ventricle, left atrium and left ventricle and it may go outside through aorta. We know that aorta having a shape. This is the aorta. From blood, from the left ventricle, it may reach here and it may go upward and downward. And there is chances of thickening of the blood vessels of the blood vessel of aorta may be thickened. And there is aneurysms, small tumors. We cannot call it tumors, but some bulgings and some swellings, and there may be chances of dissecting aneurysm. That is breaking of small blood vessel thickening, and it is like a tumor. Through that bleeding may happen, there is chances. So there may be chances of aortitis. This blood vessel may be affected with through viral diseases. And nowadays we can see that so many cases after taking the vaccines, the COVID vaccines, they are coming to us. I think that all our doctors may get such cases. There are 13 complaints, side effects of this taking the COVID vaccine. They are suffering a lot. We know that so many people died and suffering people, demyelination, that is the covering, may be damaged of the blood vessel covering may be damaged. And there is severe painful conditions. We cannot do, I don't think that we can, even in such conditions, it is very difficult to treat such cases, demyelination, because it may be it is a chronic condition and it is uncurable conditions. I don't know how it will manage. One of my friend doctor, father, having severe pain of the leg, and he went to an hospital, and after one day he died. So that was they were shocked because he having some complaints, but this is one of, there are so many cases we can nowadays we are attending. So we are giving some medicines and we can, I think that phosphates helps. Our 5 forces will help a lot in such cases. As a supplementary medicines, we can give such tissue remedies and hypericum, one of the medicine for, we can use hypericum. I suggest can reduce the pain, and radium bromide. These are some of the medicines we can use, and we can think about belladonna, arnica, hypericum, ledampal. Then another medicine, bothrops, Crotalus horridus. These are the medicines generally we can use for blood vessel complaints. This is our heart. 23rd day to our life long till our end. Blood reaches in the heart, and there is a big area of systole and diastole. Everybody knows it, so I am not going it. An electrocardiogram is a simple test that can be used to check your heart's rhythm and electrical activity. Sensors attached to the skin are used to detect the electrical signals produced by your heart each time it beats. I took more than 2 months in my college days to learn ECG, because how it is functioning, there are so many medical terms are using depolarization, polarization. All these things were very difficult. Now we can see there are so many videos in the YouTube. We can go through it. Immediately we can study how this PQRST of the ECG, how this is going, how the body is functioning. There is changes. If one is feared, it may change. It is not a, we should not consider it is an abnormal thing. If one person is fearing, that time his BP may be raised, his ECG may be raised, and the shape of the ECG may be varied. So don't think that it is a abnormality. This is a normal condition, even though in the normal condition, we can see abnormal waves passing. We know that these are the time. Why I am showing this? I have treated many cases of heart diseases. So many cases. From the beginning till now, we are treating cases, and we know that it may be changed. I have given medicines for so many heart disease conditions that there is like one person once came to my clinic. Still, I saw him 15 years back. It was during the time of the chikungunya, and that time once he died. And he rebirthed again. I saw one day he came to my clinic. I checked his heart and auscultation. I saw, I had some bad feelings. So I told him to take care ECG. So immediately, he's a very poor man, coolie. I sent him for an take an ECG. That time I saw only a small this R wave there, like an only that, only on wave, a long time on wave. I was very much afraid, and I told his friend to take him to some other doctor. I gave him medicine, and after 2 days, only day after day, the other day, they came with the second time. They went to an hospital and they took a ECG, and they showed that ECG which had taken back, previously taken. They were astonished after seeing that ECG. After 2 days, it is a normal ECG. And again, he had complaints. He went to medical college, and they were astonished after seeing all these conditions of his days of survival. They were at last, I told them to take an operation they should do, or to put a battery, and he's living now. After 15 years, he's having problems, but pacemaker, the pacemaker, and operated and made a pacemaker, and he's living now. Till here, now he's 67 years old. So he's he's taking rest. The heart is the most powerful generator of electromagnetic energy in the human body, producing the largest rhythmic electromagnetic field of any of the body's organs. The heart's electrical field is about 60 times greater in the amplitude than the electrical activity generated by the brain. The heart is the most powerful generator of electromagnetic energy in the human body. We know that sinoatrial node, power stations of our body. Sinoatrial node, SA node, then AV node, bundle branches, Purkinje fibers. These are the electrical body, electrical store stations, power stations in our body. Through this power station, heart is always functioning from the beginning till our end. Left sinoatrial node. From here start this is the most powerful energy producer. Then it comes to the bundle branches. No, sinoatrial node, SA node, AV node, and bundle branches and Purkinje fibers. Through all this electrical activity, our heart is functioning. Which are the medicines we may help most? Mostly we can use amyl nitrosum, aconite, gelsemium, argentum nitricum. These are the medicines which more affecting the heart. We can use all these medicines: amyl nitrosum, aconite, gelsemium, arsenic alb, calcarea, floricum, macfos, and these are the medicines directly affecting heart, these electrical nodes, sinoatrial node, AV node. We can directly affect, we can make an effect on these fibers, power stations of our body. If that is another medicine, that is Crataeus. Crataeus is a tonic, homeopathic tonic for heart. Then we go to back. Cardiac output. For a young, healthy man, resting cardiac output is roughly 5 liter per minute. That means 70 ml stroke volume. Each beat 17 ml, 70 ml blood will pump from heart. 72 beats. In 72 beats, 5 liter in a minute. So how powerful the heart is. Each stroke having 70 ml volume, that means 72 beats. If the beats are reducing to 72, coming back, coming down to 60, in certain persons having heart complaints, the heartbeat will be reduced. That time, the blood flow to the different parts of the body will be reduced. For women, this value is 10 to 20% lower. Why? God given her this little bit blood is enough. Because they are tensed in their life. Just a minute. So there may be chances in cholesterol. We are checking our cholesterol level. Other impurities may cause it can reduce the beats per minute. Sometimes there will be more beat. There may be a normal heart, but the heart will beat more. How? Due to thyroid functioning or thyroid diseases. Last we had taken so many classes of thyroid. We might have, most of us are heard so many classes. Heartbeats are becoming more if the thyroxine production and the hormones of the thyroid hormones are more productive. That time hypertension, there is hyperthyroidism. That time the heartbeat may be more. And in hypothyroidism, the beats, I told that the beats may be reduced and the pumping of the heart will be reduced. And it may indirectly affecting the heart. Even if he is having a good heart, that heart will be affected by hormones, the chemicals of the body, which may affect it. Now the cardiac output will be, we know that the cycle will be oxygenated by, oxygenation is one of the main reason, one thing we should have. From right ventricle, it reaches the lungs, and from there, we may get oxygen. If the oxygen is not, the lungs is not perfect, or the lungs is weak, we know that there are so many complaints of weakness of lungs. The main thing is tuberculosis. Drinking milk without boiling for several times, or at least we had to boil 5 minutes milk taking from cow. Otherwise, there will be chances of bovine tuberculosis. It may affect the lungs, and lungs will be harder. The oxygenation, the vital capacity will be reduced. The functioning of the lungs, the elasticity of the lungs will be reduced. A few, 1 month back, or 1 or 2 months back, one girl came to my clinic. He is taking all sorts of allopathic medicines. At last, they said that your lungs is shrinked. Nothing can be done. That time they came to me. I consoled her. I told that, oh, we can. I just studied the case, and I had given medicine we know that these are the medicines I used. Arsenic alba, antidote, belladonna, for to reduce other infections, for to reduce the infections. We had to remove infections. Beratropyrate, pulsatile, and all medicines. We are generally using medicines I had given her. Within 1 month, he is okay. Now she is completely, he checked. And last she had some doubt. Within 1 month, everything is over. She is now normal. I told her to take some exercises also, some breathing exercises also. A good breathing exercise I will show you now. Just we breathe like this. Raise like this. We keep our hands like this and take the breath and for some time and keep it for some time and then double and exhale the whole air in the lungs. It's a good exercise. It is used in Kalaripayat. And we have to take this like this. What is the meaning of this means? What's happening there is, while we are keeping like this, our cage, of our our column cage, this cage, chest cage, will give maximum expansion. That time we can take more air. And while we are going upwards, this hand going upwards, that time the lungs, heart, and every internal organs will be squeezed. First, relaxed condition, then taking deep breath and keeping the hand upwards means the whole chest cage will be shrink and there will be pressure in the area, and we are exhale all the air like this, and we exhale most, bending double while sitting in a position, in a lotus posture or in any posture, in an easy posture. Then exhale the whole air, even from the anatomical dead space of our windpipe. That time we can take maximum air, maximum squeeze, maximum exhalation, expelling all the air. This is a very effective exercise for heart, lungs, and the brain. We Christians, we pray like this: Father, Son, and the Holy Spirit. Amen. What is the meaning of it? Father, that means our brain. That is the central nervous system. Put it in our body. God put it in our body. Heart, that is Son, that is connected with Jesus Christ. That is, He is the blood giving person. And the lungs, that is, we call it as Holy Spirit. That is air. It is a miniature of Father, Son, and Holy Spirit we can see in our body. God created like this man. A central nervous system, that is the Father. The Son, that is giving the blood. Jesus, that lungs, that is the Holy Spirit. So, whenever a person is healthy, the three system will be perfect. When the person is weak, the three system will be damaged. Between this, there may be chances of weakness of the brain, weakness of the heart, weakness of the lungs. Where is Sora? Where is Sora? It was in our heart. It came to our heart while during the conception. Till then, the Sora is living. Whenever the spirit came to our mother's womb, the body, the man is impure. That godly power came to the man, that impurity even touched our spirit. That is why all persons are in every religion and every prayers. We are doing this to cleansing ourselves. We are going to Ganga and taking Snana, स्नान करना चाहता है, bathing, cleaning the body. We have to remove the whole body. We have to remove the all impurities of the body. It may start from the heart, from the thinking process. Every evil thing is making one impure. A good heart, a good mind, a good body, that is what our aim. That is what Hanuman said. Our aim is to, the first and foremost thing is the motto of the person is to recover from the, or what is the word we are using? coming back to our normal stage. Manasa, vacha, karmana. Through all these things, we are taking impurities from the world. Even though if we are living a pure life, then if the atmosphere is polluted, it may affect us. If the atmosphere contaminated with many bad, evil things, that may affect us. If a person who is not having good friends, it may affect. If one person having bad friends, that is it saying, a proverb that, tell me your friend, I will tell you who you are. So, satsang is good for to keep ourselves better. Our heart should be better. Our pumping should be better. Our everything should be better. Then let us go to some of our medicines which are helping more. These are the medicines I just going through. Or metallicum, heart sensation as if the heart stopped beating for 2 or 3 seconds, immediately followed by a tumultuous rebound with sinking at the epigastrum, palpitation, pulse, rapid, feeble, irregular, hypertrophy, high blood pressure, valvular lesions of atherosclerotic nature, aurum metallicum 30 is recommended. Now, Bothrops. It is a venom of most coagulating. We should expect to find under these remedies the symptomatology of thrombosis, also thrombotic other conditions. We please go through it. Then, calcarea fluorica, I told that. Circulatory organs, chief remedy for vascular tumors with dilated blood vessels and for varicose and enlarged veins, aneurysms, valvular disease, when the tuberculous toxins attack the heart and blood vessels. This is very important. Please watch it. Circulatory system of calcarea fluorica. All having boric. Next medicine is Spigelia. I got many cases I treated with Spigelia and good results, but you must always think about heart, violent palpitation, precordial pain, and great aggravation from movement, frequent attacks of palpitation, especially fall orders from mouth, fall orders, pericarditis with sticking pains and palpating dyspnea, neuralgia extending to arm and both arms, angina pectoris, craving for hot water, which relieves rheumatic carditis, trembling pulse, whole left side dyspnea must life I am using. This is the first medicine. I will say that Spigelia is the first medicine. Then coffee. Yesterday our things are told everything about coffee, so I am not going about it. Now, cactus, another medicine. Chest oppression, breathing, other things we can see. And another medicines, cinchona, Gelsemium. These are the medicines I want to say. Both of now I can see our doctor. Hello, doctor. Both of. Hello, doctor. Sir, I used your medicine. You gave me that chance to treat a case with Bothrops and got an immediate result for a COVID case, COVID affected brain case. It is immediately that within days, all the clots, small clots were in her brain that is cleared. So thank you very much, sir. Wonderful effect, I got it. I never used that medicine before that. I used after the only from your class, I used that medicine. So thank you very much. And now, very much for all of you. I am completing here. I am concluding here. If there is any doubts, don't ask big questions. I never answer. Today only evening, Danesh called me to take a class. So I just make a class. So you can ask, I can, if I know I can say.
Yeah, definitely. It's a very good session indeed, Dr. Hibbert. You really come out with a beautiful presentation within 4 hours of our meeting. And that's the beauty of Dr. Hibbert. You talk about why this heart is pumping, what are the different stages of heart when you are in the womb of the mother, and how it develops, and what are the conditions which may produce some kind of illness in the a person, and as and when the illness happens, how homeopathy medicine works, and what are the medicines that can be used during the situation. Anyway, congratulations for your beautiful session here.
Thank
And
you.
I invite Dr. Bob Lim to say a few words. Dr. Bob Lim?
Oh, yeah. Huh. Okay, good day, Dr. Hubert de Silva. I always enjoy your session. And you have presented a very good webinar tonight about cardiology. And for those who have already seniors, it is also a good refreshing course. And for those who are students and new, I think it is something very informative. And you started very, very basic and very well and very detailed. And you go on to the one we are looking for. Most of those are the remedies that we can use in relation to these cardiovascular diseases. And okay, I just like to ask that you say that is basically cardio has a relation with SORA. So what are the SORA remedies that you are using?
These are the
Dr.
medicines.
Hubert?
These are the medicines. What I said, these are the medicines I got. Even if after that we can give some other medicines, sulfur or because the action of, we know that the sulfur is going from inwards to outwards. We can, whatever impurities we have to remove, sulfur can be used as an intercurrent medicine or as a miasmatic medicine. That's all.
We have repertorized based on the physical general also, right?
Pardon?
We repertorize on the physical general, the symptom. Right?
I just superficially go to all the medicines. I am not going deeper into it because I don't feel I use that medicine. If I use some medicines, if it is getting much efficient efficacy, then only I use that medicine. I never. If the medicine is not powerful to make a symbol, if we are giving a dose, then there is no action, then I will not use that medicine, never. That's my character.
So what is
I
your
will
potency?
throw it away.
What is your potency?
200 potency is okay.
So for 200, you only give one dose, or you repeat it?
No, repeated doses. But I give very medicated globules. I used only 3 globules at a time. Three
what
times
is the protocol you are given for 200, Dr. Hubert?
The 200 medicated globules in 3 times a day.
3 times a day, daily or what?
Daily.
Wow.
Till there is getting any getting some relief, then I shall say that you must immediately stop that medicine. I never give medicine more. If getting a relief, then I should say, I will always say that you have to completely stop the medicine.
Okay, thank you very much.
Now I invite Dr. Ramprasad sir to say a few words.
Thank you, Dr. Dhaneji, and congratulations, Dr. Hubert de Silva. Very nice presentation, excellent session, dynamic presentation. Vascular cardiac diseases. Many kinds of medicine. Sulfur is a good medicine and soric in nature. So, thank you, very, very thanks. Behalf of IFPH, very, very thanks. And again, presentation. Thank you.
Thank you, sir. Thank you.
I invite Dr. Madhusudana Panikkar sir to say a few words In the last part of the session, you heard from Dr. Hubert. Oh, sorry. Sir didn't put him here. Okay, now I invite Dr. Ramadevi Ambadi to come up with your comments, as well as you can say the vote of thanks to the session also. Ambadi, Doctor, please unmute. Ramadevi Ambadi, madam, are you there?
Okay, that's all.
Okay, then if anybody want to have a question to Dr. Hubert, you can ask now.
ഡോക്ടറുടെ ക്ലാസ് കേട്ടാ ഭയങ്കര ഗ്രാൻഡ് ആയിരുന്നു. ഒത്തിരി പണ്ട് എനിക്ക് അറിയത്തില്ലാത്തതുകൊണ്ടായിരിക്കും. നൗ യു ആർ ഇൻ ഒരു ക്രോണിക് വിദഗ്ധൻ.
Yes.
നന്നായിട്ടുണ്ട്. അപ്രോച്ച് നല്ലതാണ്. പിന്നെ അത്രയും പേടിക്കേണ്ട കാര്യം കേട്ടോ. ഇമ്പ്രൂവ് ചെയ്താൽ ഉടനെ അങ്ങോട്ട് എറിഞ്ഞൊന്നും പോകേണ്ട കാര്യമില്ല. ബോത്ത്റോംസ് ഒക്കെ 0 ഉപയോഗിക്കുകയാണെങ്കിൽ വി ക്യാൻ കണ്ടിന്യൂ ഇറ്റ്. കാര്യം കൊറോണറി വാസ്കുലർ ഡിസീസിൽ, ബ്രെയിൻ ട്യൂമറിലൊക്കെ, അപേക്ഷയിലൊക്കെ നമ്മള് പലപ്പോഴും വരുന്ന ഒരു കുഴപ്പമെന്ന് പറഞ്ഞു കഴിഞ്ഞാല് നമ്മൾ ചിലപ്പോൾ തേരട്ടി കൊടുത്ത് വെയിറ്റ് ചെയ്തിട്ട് ഇമ്പ്രൂവ്മെന്റ്, ഇപ്പൊ 1 മാസത്തെ മരുന്ന് കൊടുത്തു വിടുമ്പം 15 ദിവസം കഴിഞ്ഞ് ഇമ്പ്രൂവ്മെന്റ് പോയതാൽ ആ പേഷ്യന്റ് ചിലപ്പോൾ വെയിറ്റ് ചെയ്ത് കഴിച്ചിട്ടേ വരത്തുള്ളൂ. അപ്പൊ ആ പേഷ്യന്റിന് നമ്മൾ റിപ്പീറ്റ് ചെയ്യണത് ഓരോരുത്തരുടെയും കോൺസ്റ്റിറ്റ്യൂഷനും തെർമലും സെൻസിറ്റീവ്നെസ്സും ഒക്കെ വെച്ചായിരിക്കണമല്ലോ. പിന്നെ നമുക്ക് കിട്ടുന്ന മെഡിസിന്റെ ക്വാളിറ്റി ഒരു പ്രശ്നമാണ്. അപ്പൊ അതുകൊണ്ട് ക്രോണിക് ഇതുപോലുള്ള ഇമ്പ്രൂവ് ചെയ്യുന്ന നല്ല കേസസിൽ ഡെഫിനറ്റ് ആയിട്ട് നമുക്ക് മെറ്റീരിയൽ മേടിക്കുക ക്ലോസ് കിട്ടുവാണെങ്കിൽ വി ക്യാൻ പ്രൊസീഡ് വിത്ത് 0. പിന്നെ ഡോക്ടറുടെ പോലെ തന്നെ ഇപ്പൊ സ്കിന്നില് ആസ്മയിലൊക്കെ ആണെങ്കിൽ നമ്മൾ തേർട്ടി കൊടുത്ത് വെയിറ്റ് ചെയ്യാനാണ് ഇപ്പോഴത്തെ ലേറ്റസ്റ്റ് ലീഡിംഗ്.
Okay, sir. Thank you very much for your comments to Dr. Hubert. And it is the time to wind up the session. I invite Dr. Bob Lim to say vote of thanks to the session also.
Okay, thank you very much. I am Bob Lim from Malaysia. On behalf of the IFPH, I would like to express my sincere gratitude to Dr. Hubert for giving us a very dynamic session, as someone mentioned. Very clear and very precise, and you explained very, very well. Okay, thank you very much, Dr. Hubert. We hope to hear from you again.
Thank you, doctor. Thank you. Very happy.
Tomorrow we will have a session from Dr. Shashi Mohan Sharma, who is the director and principal Hanimanian College of Homeopathy, United Kingdom, that is UK. So the subject will be homeopathic treatment for incurable disease. So that sir was there for so many sessions, some last year, but this is the first time sir is coming in this year. So with that, we come to the end of the day, 1425. We are very happy to say thank you to Dr. Hubert De Silva for this excellent session in a short time. That is, within 4 hours, Dr. generated a beautiful session. And those who participated in the session also, we are thanking you also. We can meet again tomorrow at the same time. Hope you enjoyed the session. Thank you all.
Thank you, doctor. Thank you, doctor. Thank you all.
It's over to Dr. P. Shaila to moderate the Malayalam session.